Hi, everyone. My name is Carrie Carlson, and I'm a brain injury specialist with Brain Links. I'm going to go over a small section. This is about 5 slides, I think, from the webinar series that we did with the Tennessee Department of Children's Services. This is the first webinar that was on concussion, traumatic brain injury, and abusive head trauma. So I'm going to go ahead and get started here. If you have any questions or concerns, you can always comment on this, and we'll get back to you. So I'm going to go over long-term consequences of traumatic brain injury. So please remember, before I even start, that every brain injury is different, and that there's no time limit on healing. That is a process, and that depends on how the injury actually happens. And we're going to talk about long-term consequences of TBI, but most people do fully recover from a concussion, which is a traumatic brain injury. So let's get started. So need for ongoing monitoring and treatment. So this is across the spectrum. This is across everybody's age group, more so with children, because children, their brains are still growing and developing. So we really need to be vigilant and watch for some of these ongoing needs that kids have. So they are more likely to have another injury. Studies suggest that after one injury, you're 3 times more likely to sustain another injury, and so on. And I do want to point out too that also athletes are more likely to have another concussion than somebody who plays video games or does something that doesn't involve much contact. I will tell you though that only 10% of concussions are sports related. So saying that, you never know when you're going to find yourself in one of these situations, or your kids. Becoming obese. So the state of Tennessee is already one of 12 states with food insecurities. And when you've had a traumatic brain injury and you have food insecurities, both, you're more likely to have some cognitive deficits as a child. Your brain needs all that healthy, good food to develop properly. And also, when you've had a brain injury or a concussion, your brain needs that healthy food to heal and sleep and everything else. So tune into the brain health webinar, that Wendy's going to do later in July, and she's going to go over all kinds of great stuff about that. But becoming incarcerated, I'm going to talk about that in the next slide, along with abusing substances. So becoming depressed and becoming socially isolated, those are things that can be a direct result of the injury, but those can also be things that, psychosocial is affected, which is another web series that we've done with DCS. And your peers are more likely to pick up on these things, especially when you've had a brain injury and things aren't exactly the same as they used to be. So we need to really be watching kids for that. Plus, it's hard being a kid. It's hard being an adult, but it's hard being a kid. And so ages 15 to 19 with TBI, they are more likely to have anxiety, depression. I just went over a little bit of that. ADHD. And remember, this is after an injury also. And I do want to point out too that ADHD and TBI symptoms can sometimes look very, very similar. So if the injury is not remembered, maybe that it's not ADHD. Maybe they need some supports for a brain injury. Attempted suicide. This is a very sensitive subject for everyone, I know. Please use people first language with this. We need to say attempted suicide, not committed suicide, died from suicide. And also be very, very vigilant if someone who is a celebrity or somebody that's in the news very often does die from suicide, because studies have shown time and time again that increases the rate of the attempts and the actual people who pass away. So abuse alcohol and drugs. So the American Academy of Pediatrics already suggests for kids who don't have a lot of ACEs behind them, have never had a brain injury or concussion, that the physicians start screening children at the age of 9. That's young. So obviously at the age of 9, you have to be in a household where you can have access to this. But please don't think, oh, they're only 10, they're only 11. That can't be the case. We need to be remembering this and bring it up to the doctor if you're a foster parent and there's a history of substance use, but also they've had a brain injury. Like, keep that brain injury on your radar. American Academy of Pediatrics wants physicians screening at 9, and that's pre-brain injury. So juvenile justice system. So within 5 years post-injury, nearly 1/3 of all people across the board have some involvement within the criminal justice system. That can be small petty things to large crimes. So 41% of people in the juvenile justice system report having a traumatic brain injury. Remember, traumatic brain injury is a concussion, so that what people think is a quote-unquote minor ding, that falls into that category also. And within kids in within the adult prisons, these are juveniles in adult prisons, over 50% report being attacked by a weapon, and that's from staff. So you never know what else is going on. Please, please, please screen any kids getting out of this system. Even if they've just been in the local jail for a while, we need to be vigilant because these injuries do happen in large numbers within people that are in the system. And 50 to 80% of people that are in the adult prisons report of having had a concussion, traumatic brain injury. So please screen these kids and families and parents. The odds are against them with getting or having another interaction within the justice system after a head injury. Substance use. I already talked about the kids. That 70 to 80% of people are discharged with an opioid prescription. Most of the time it's needed. However, if we give them the ability to know that, hey, I know that you were in this car accident, you've got some pretty serious injuries, but please remember that you are 10 to 20% more likely to develop a substance use disorder. So just make sure that you're watching this as well. That might give somebody the power to take that into their own hands and to recognize if there's a pattern of abuse happening with that substance, because people are more likely to develop substance use, even people that have no history of abusing drugs or alcohol. So just keep that in the back of your mind also. And then, of course, it's greater for somebody who has had a pattern of it, and especially more so, as this slide says, 50%. If you've had an injury because of substances or alcohol, you are even more greater of a chance to develop a worse pattern of abuse. And then this is a perfect example. So this is Nathan. He was injured at 10 months old. He fell down a flight of stairs. He was seen at the hospital. This is not a concussion. He had no loss of consciousness, which usually doesn't happen. People usually do not lose consciousness from a concussion, right? He had bruising around his right eyes for weeks. That tells me that this was a little bit more possibly serious than a concussion. I'm not a physician. However, that's pretty bad. He's currently in prison. He's an addict. He can't and won't hold a job. He's got very few friends, and he's got borderline personality disorder. So, the parents say he won't get help. Maybe he doesn't know how to get help. Maybe he can't identify that it was that brain injury. He could be having impulse control problems all the way still from that injury. Yes, it was at 10 months, but if he never got the supports and services needed, he doesn't know or understand what's going on with him. So that's so sad. But this is a perfect example of why we need to keep monitoring these kids as they grow into adults and keep some kind of record that injury happened. Because no matter when the injury happened, you can still get supports and services later on. You can still heal your brain. get on that brain health video or webinar. I keep saying video, webinar. And please follow us on our social media. We have Facebook, we have LinkedIn, we're soon to have Twitter, very, very soon. We have a YouTube channel. This is where you guys are at. And our website has some amazing resources for everyone. Here's our contact information. If you need to contact any of us, I'm Carrie. I'm in West Tennessee. But we would all be happy to answer any questions that anyone may have regarding anything that you've seen here today. Thank you and have a great day.